So we know that the rate of screening uptake amongst ethnic minority women could be a lot better.
Black, Asian minority ethnic people tend to suffer more in terms of death and illness than white people, and that's partly because they don't go for their checkups. There's lots of different reasons, but today we want to find out why you don't go for your bowel screening, why you don't go for your cervical screening, why you don't go for your breast screening, and what we can do, what the NHS here can do to make it easier for you.
We as a family get so happy when we hear of somebody having bone marrow transplant and they live and they're leading a healthy life. And we as a family feel, oh wow, my brother's alive today because this person has survived leukemia, my brother didn't. So this is an illness that devastates families. I can still see that sadness in my mom's eye. When we used to see my brother suffer, the whole family suffered his pain. And the key is, if you have any symptoms or if you doubt something, please go and get it checked.
What will help you to come forward? What are the things that will help you? Because it's really important. You need to tell us.
People don't even get encouragement from their husband. I think many people, Asian people, most of the time, if their husband isn't educated, they will not tell their wife, go and get yourself checked. Because they say, why are you going to show your breast to people? Just go and sit and do some roti for me. This is the type of mentality that we have most of the Asian community. Education.
Importance, knowing the importance of getting tested. Like now, I myself don't remember, did I ever go for a test?
If there is something, you can start the treatment early.
Okay, so getting that message out. What you're saying is getting the message out that if it's caught early, it can be treated. That's really important because that will take some of the fear away.
I think within the East African community, particularly from where I'm from, there's a lot of fear of the unknown, so people are less likely to come forward. What if I have something? I'd rather not know. It's almost that aspect,
Do I think that's something worth capturing. How do we deal with I'll rather not know? That's a massive thing. So we're going to the Somali Women's Center and we are going to look at how they are raising awareness in the community around breast cancer screening and the support that they're putting around women to overcome their fear and embarrassment or any other reasons why they struggle to access breast cancer screening.
I do take some things for granted, of course, being a GP and speaking the language. So language, as in not enough literature in your mother tongue or our mother tongue, not the right mediums being used, even if they do use the right languages. So sometimes when aunties come to me and say to me, oh, you're a GP, why did you become a GP? You could have done something else. And not because they look down on GPs, it's because they feel GPs just sit there and pretend to listen and sign a quick prescription and go away.
You'll all be invited to routine mammograms every 3 years, and again, that's our screening programme.
So these ladies said they never even received the letters yet. This lady said, I have received the letter from NHS England, but I have never been. And I asked her, what is your reason for not going? Are you worried? Is it because you don't understand? She said, I'm not scared, I'm not worried. I just don't feel anything's wrong with me.
This for me is a really important example of why our approach to tackling healthcare inequalities needs to include listening very deeply to people and communities.